The 11-county trauma service area covering Austin has a record number of COVID patients in the ICU. Some local hospitals are administering more antibody treatments to keep patients from having to be hospitalized.
Baylor Scott & White says it's been giving out 40% more antibody treatments in the last few weeks. As KXAN's Tahara Rahman reports, they're also part of a trial to make that treatment more efficient.
Okay, got tested.
When Victoria McKenna was diagnosed with COVID-19, she wasn't worried because she was young and healthy.
Well, I was wrong.
Within days, she developed eye pain and hallucinations.
It's not like an ashtray or like I was locked in a burning building and you just can't escape it, and it's solely in your nose.
She also lost energy and had difficulty breathing.
There were a lot of times when I, couldn't get that breath in, and I said, oh, maybe I should just go to the hospital. Maybe they can give me something that would help me.
To keep that from happening, doctors can recommend COVID-19 antibody therapy.
So far, we have shown great benefit for the antibodies, decreasing the risk of hospitalization or worse by 70 to 87% if given early.
Dr. Robert Gottlieb is with Baylor Scott & White. He's working on turning that IV treatment into shots that can eventually be self-administered, like insulin.
That way, we wouldn't need to overburden our healthcare entities that are delivering care to the critically ill.
It worked for McKenna. She saw improvement the day after getting 4 shots in her stomach, but she hopes to avoid another encounter with COVID by getting the vaccine.
When you're in that situation, there's no going back. You just have to really wait it out and hope that your body can take the toll of that virus.
Tahira Rahman, KXAN News.
The COVID-19 antibody therapy trial at Baylor Scott & White is sponsored by pharmaceutical company Eli Lilly, and results are expected to come in the next few weeks.
Last month, we told you about another treatment option that could soon be available. Austin-based drug developer TFF Pharmaceuticals is working to launch a COVID-19 antibody treatment in the form of an inhaler. It rapidly coats the lungs with virus-neutralizing antibodies. The company now tells us that it has started animal safety studies and plans to be in FDA human clinical studies early next year. The antibody treatment has demonstrated success in preventing severe illness against many variants, including Delta.